So obviously one of your main functions is going to be to take inbound telephone calls, and all of the inbound telephone calls should be answered within 3 rings. We also set a clinic phone within the clinic so that the assistants and even the doctor can help answering phones. So the clinical staff, if they do hear that second ring, they should also be jumping at the chance to answer that telephone call. Any calls that aren't answered within 3 rings are set to be automatically forwarded to the answering service. And we don't really need to be changing any settings. For example, if you are out a day, you don't need to set it up for you to forward those calls because those calls will automatically be answered after the third ring by the answering service. Um, if you do have a meeting and you do need to put the phones on silence during your staff meeting, then you'll just alert the Open and Affordable Dental answering service of your meeting, and they will go ahead and take telephone calls during that meeting, and you can simply just silence your phones. So for the inbound telephone call dialogue, it's important that we all use the same welcoming greeting every single time. And the standard greeting, if you are an in-office front, will be Open and Affordable Dental. This is Dr. Stott. How may I help you? Or your name. So there's a lot of different versions of that I've seen. And so we've listed all of those versions that we don't want you to say. So, for example, I hear this quite a bit. Open and affordable. This is Dr. Stott. How may I help you? The patients might not understand that this is a dental office, so make sure that you don't forget the word dental. The other thing that I hear is open and affordable dental. How may I help you? Without stating your name. Again, common courtesy to state your name. And then sometimes I hear this open and affordable dental. This is Dr. Stott. And you need to make sure that you don't forget to say, how may I help you? So just practice that and listen to the fronts. They should be saying open and affordable dental. This is their name. How may I help you? On the answering service side, very, very similar. Open and affordable dental. This is Dr. Stott. How may I help you? The patient will go ahead and explain what their problem is, after which you will ask them, at which office are you usually seen? And then you'll go into their system and take care of them. Okay. Occasionally, the patients there'll be a couple of phone calls that come in at the same time. And to accommodate that, what you'll do is you'll ask the patient who you're currently on the phone with if it's okay for them to be put on hold. So you'll say, "May I put you on a brief hold?" You'll go ahead and put them on hold and answer the other phone call. Again, don't just put them on hold. Make sure that you kindly ask them if you can before you do that. Occasionally, you'll get an upset patient, and the way that you need to really address this is obviously stay calm. It's usually not against you. It's usually against something that happened potentially at our office or maybe at another office, or they've been, they're in pain right now and they're just kind of taking out their frustrations on you. So, uh, all of our inbound telephone calls are recorded. So just make a note of the patient and the time that the phone call was received, and then you can give that to the doctor and they can listen to that later to see exactly what happened. And if at any point the patient starts raising their voice, yelling at you, using profanity, or making personal attacks, it's appropriate to alert the patient that the phone call is going to be disconnected. And then again, just make a note of the phone call and the time that it was received, and we can listen to that later and see if there's anything that we can do. But ultimately, it is the doctor's responsibility to take care of that. And don't let that negative patient affect your morale or the rest of your day. We are unfortunately a dental hospital and patients are in pain. So having patients a little bit upset unfortunately is part of the job.